We're all familiar with the phrase, "this is a no-brainer." It's a phrase commonly used in business and politics, sports, and really many everyday circumstances. A no-brainer describes a choice, a decision, or a solution that is easy, it's obvious, it's straightforward, and really should be immediately clear. Well, in this video, I'm going to share with you a Medicare no-brainer. Now, to be fair, there are lots of decisions surrounding Medicare that are not so easy. They're not no-brainers. But there are three very specific situations that if you were to ever find yourself in, you should absolutely not consider choosing to be covered by a Medicare supplemental plan. So in these three situations, your decision would truly be a no-brainer. Let me explain why. Now, I want to begin this video by prefacing this. Folks, I love supplemental plans. In fact, I'll be on Medicare here in just a couple months, and I'm going to go with the supplemental plan. But there are times when supplemental plans are just not going to work for people. It's just simply not a fit. Now, I like supplemental plans because I like the fact that they're permanent. You never have to worry about them being canceled by an insurance company. You pay a premium and you're done. You can never be canceled because you move, because you have a lot of claims, because you're older. That just never happens. They're permanent policies that are totally portable. I also like them because we have no networks. When we are on a network plan, we have limitations for providers. When you have a supplemental plan, any provider that takes original Medicare, and 99% of all docs do, 100% of all hospitals do, you can go anywhere you want as long as they take Medicare. So I like that fact. I also like the fact that I would rarely ever have a pre-authorization by Medicare and never by a supplemental plan. I don't have to work with an insurance company to make sure when my doctor says I need something that it has to be approved by the insurance company. That never happens on a supplemental plan. Now, it is true Medicare itself has a few pre-authorizations, but they're very, very rare. And so the point is there are aspects of supplemental plans that I think are wonderful. And I'm going to be on one here in just a couple months. But again, it doesn't work for everyone. So there's some of you watching this where I'm telling you, you should not get a supplemental plan. There's three reasons why. So here we go. Number one is this: because you have what we refer to as dual eligibility. Dual eligibility. Well, what does that mean? Well, here's what it means. It means that you've been covered by Medicaid. You've been approved on your state Medicaid's plan. And this is typically based upon income and assets, resources. And so you qualified to have the state pay for the majority of your medical expenses. And so what's been happening is Medicaid has been providing very good insurance for you. They're the first payer, and you may have had some out of pocket. We call that a spin down. Most people don't have spin down. But the point is, you've been covered well under this system. But now what's happening, you are now eligible for Medicare. Well, why is that? Well, you're probably turning 65 and now you have this eligibility, or it could be that you've been on Social Security disability for 24 months, and on the 25th month, your Medicare A and B automatically begins. You're auto-enrolled. And so that could be you. You could be below 65 and you're on that 25th month. And so what happens though now is Medicaid's no longer going to pay first. So in this position, your Medicare pays first, and your Medicaid is going to be the second payer, right? And so you're in a status of dual eligibility. Not only are you eligible for Medicaid, now you're eligible also for Medicare. All right, so have two more aspects here I want to share with this if you're dual eligible, and that's this. I call this the technical side. Technically, you are really not eligible to get a Medicare supplemental plan. Okay, technically. And the reason for that is because your Part B premium is actually being paid by, in part or in full, by state Medicaid. And the rules are, if your Part B is being paid by somebody else, whether that's the federal government or Medicaid, then you're not eligible to apply for a Medicare supplemental plan. You're just not. So that's the technical side. So officially, legally, you can't. But there's also a practical side, and that is this. There are plans that are designed specifically for people who are dual eligible. And these are Medicare Advantage plans that we give the acronym DSNP. And that DSNP stands for Dual Eligibility Medicare Medicaid Special Needs Plan, meaning it's a plan designed specifically for those that have this dual eligibility. And so they frankly are pretty rich in benefits. Why? Because not only is Medicare paying for some of your healthcare expenses and providing benefits, so is state Medicaid. And so again, they're very, very attractive Medicare Advantage plans for people that are both Medicare eligible and Medicaid eligible. So that's what I'm saying. You should not get a MedSup plan if you're dual eligible. All right, that brings us into reason number 2 why you should not get a Medicare supplemental plan, and that's this: because you can't qualify. Okay, you can't. Well, let's go through this scenario. Let's start off by sharing this scenario. I'm going to give you an example. You started with an Advantage plan, and so what I mean by this is when you, let's say you retired at 65 and you're going on Medicare, and let's use the date of birth of 1/3/1959. Okay, and this is a person that retires at 65, and they're going to start Medicare, and so in this example, they're going to have an A date of 1/1/2024, right? They're born in 59, add 65 to that, we have an A date of 1/1/24, and we have a B date of 1/1/2024, all right? And they made the decision to enroll into an Advantage plan. And so what happens is this: if they stay on this Advantage plan for longer than a year, 3 years, 5 years, or some period of time, what's going to happen is now, in order to get off that Advantage plan, now they're going to have to medically qualify. We're going to have to ask them 35, 40 health questions, check all their medications, look at their pre-existing conditions. All right. And so if someone cannot pass through underwriting, they cannot make the switch. All right. So let me explain how this works. So let's say someone's in this scenario here and they decided, hey, I want to switch to a Medigap policy. Well, the question is always, why would someone want to do that? Well, the reason people do that is because sometimes they get kind of fed up with having to deal with network doctors as they've had to on their Advantage plan. They don't want that any longer. Or maybe they're concerned about some serious health issue in the future and they don't want to be concerned about their coverage. Or maybe they're tired of pre-authorizations. Pre-authorizations are required by Advantage plans on a regular basis. Actually, 27% of the services needed have to have a pre-authorization. So people say, I'm done with that. Or they want a permanent policy instead of just an annual policy. So there's a variety of reasons, but now they made this decision, I want to switch to it. But now they're going to have to do what? They have to medically qualify to make that switch. So what do we have? We have to go through the underwriting process. Again, we have to ask you 35 or 40 health questions you have to say no to, check your meds, look at your pre-existing conditions, maybe get a statement from your doctor. So we have this process to make the switch. Now, I do want to clarify something. Underwriting for a Medigap policy, there is a period of time when people do not have to go through underwriting, and that is when they first go on Medicare. In every state in the country, this is the rule. You have what we call a Medigap OEP, and the Medigap OEP, open enrollment period, is tied to your B date, and this period of time lasts for 6 months, and that's it. So during this 6-month window, there's no underwriting. Insurance company has to take you, regardless of your medications, pre-existing conditions. They don't even ask you health questions because they can't. You're in what we call a guaranteed issue right. And so in this example, someone who started Medicare 1/1/2024, they had it for 6 months, which means what? January, February, March, April, May, June. And so this means 7/1/2024 on. If they ever want a MedSup plan, they're going to now have to medically qualify. Now, the exception to this rule, 6 months, would be if you live in the state of New York, Connecticut, Maine, Massachusetts. They don't have this rule. They have different rules, a little bit more favorable to you. But everywhere else, all 46 states and DC, this is the rule we have. 6 months, no underwriting after that, you're going to have to. So now we have someone's in a position where they've been on this Advantage plan for a while, and now they want to make a switch. We have to go through underwriting. The 6-month OEP is now gone. So we have a couple rules about making this switch, and that's first off is the timing. You can't just do this anytime you want to. We have 2 times a year we can do it. October 15th through December 7th, and January 1 to March 31. March 31. Now, we call this one the AEP, and we call this one the Medicare Advantage OEP. So we have 2 times a year, 7 weeks here, 3 months here. where we can actually make the switch. And what we're doing with the switch is we're returning back to original Medicare A and B. And you can definitely do that without no underwriting. But because of all the financial gaps, liabilities here, most people want to add either an F plan or a G plan or an N plan so they don't have to pay out of their own pocket, all right? And so in order to be able to get one of these plans, you now have to medically qualify because, again, we're beyond that 6 months. We've been on that Advantage plan, longer than a year. So that's the timing of the switch it. So what's the process? Again, 35 to 40 health questions. We're going to ask those questions to you, and you have to say no to all of them, which means if you have rheumatoid arthritis, you're going to say, if I ask you that you have rheumatoid arthritis, you're going to say yes, you're declined. Do you have spinal stenosis? Yes, I do. You're declined. Are you an insulin-dependent diabetic? Some carriers, you'd be declined. AFib in your medical records? Yes, you're declined. And so the point is, we're going to look at health issues, heart, lung, liver, kidney, cancer, diabetes. Now, again, with cancer, if it's way in your past, 3, 4, 5 years ago, may not be an issue. But if it's active, certainly not going to be approved. So they have the right, they, meaning the insurance companies, have the right to deny your application. Up here, they can't deny you. They have to take you. But after that, they're not required to do so. So that's the process. So again, if you're healthy, then you can make the move. But again, if you're not healthy, you can't qualify. You're going to have to stay on that Advantage plan. All right, that brings us into the last reason why you shouldn't be on a Medicare Supplemental plan, and that's this: because you simply can't afford the premiums. It's simply not in your budget. I've been doing this a long time, and I find people that try to get a supplemental plan, but it's really not in the budget. They hardly ever keep them, certainly not long term. And so if you can't afford it, you shouldn't try to get it. So let's talk about this. Very simple. When we go on Medicare, we have 3 different options for using our Medicare. Now, I'm going to list this one first. It's the worst option. But if someone does A and B only, this means they have no drug plan, they have no supplemental plan, no Advantage plan, nothing, just A and B only. Now, on a monthly basis, this is typically about the cheapest. Because right now, the Part B premium, this Part B, is $185 a month. Now, it's going to go up in 2026. We don't know to what yet. But the point is, that's all they pay on a monthly basis. Nothing else whatsoever. The second option we have to use our Medicare is, again, to enroll in Medicare A and B, but we have to get a Medigap policy to fill in the financial gaps, and then we get a separate Part D plan. So in this scenario, I spent $185 this year. A Medigap policy is going to run me, depending upon what you get, folks, it's going to be somewhere between about $100 to $150 on a monthly basis. This would be like an N plan versus a G plan, and we write in all states. So again, I'm just giving you kind of an average, but there's a monthly premium. And then we have a Part D plan. Now, some Part D plans are $0, and some are upwards to $100. And it just depends on how many meds you take, how broad of a formulary that you need to have. And again, these can be changed annually. But the point is, we have more premiums involved with this. So let's just say I have a drug plan that's $0, and I'm on an N plan that's $100. I'm still going to spend $285 on a monthly basis, right? $285. But let's say if I had a G plan, which the majority of people do, now we're talking $335, and let's say my drug plan is $25. Now I'm talking $360 on a monthly basis. So my point is, it's going to vary around that $300 range, and sometimes people just simply cannot make that happen in their budget. It just doesn't work, okay? And I think everyone needs to live within their means. And so these are very, very much premium-based coverage. But if you can't afford it, you just simply can't. The other option we have is to, again, enroll in A and B, and then replace that by a Part C plan, and this is where we talk about the Advantage plans. Okay? Now, if I cannot afford number 2, I definitely don't want to do that. There's too much risk, too much exposure. There really is. So what I would do in this scenario is I would go with an Advantage plan. I would try to find an Advantage plan where my doctors are covered, my hospitals are covered, my medications are covered, and that's really a good option. Because why? Because many of the Advantage plans are going to have a 0 premium or a very low premium, and almost always they include a Part D plan as part of that package as well. Okay, and again, it's usually going to be 0, and we don't have the 2026 plans out yet, but they're going to be lower costs. So what have I done? I have $185, exactly what I had up here. But the difference is, this is all I had. Now I have this Advantage plan that includes a D plan, and the Advantage plan is going to set an annual max out of pocket. Up here, max out of pocket is unlimited. just keeps going and going and going. And it's the 20% co-insurance that really hurts people. But down here, I just pay as I go, some copay, some co-insurance, but eventually it will stop. My max out of pocket may be $3,000 for the year, maybe $5,000 for the year. Even if it's $10,000, that's a whole lot better than being on A and B only. And then what we do with a lot of our clients today, what they're doing to kind of offset some of this max out of pocket is they'll add a hospital indemnity plan or a critical illness plan to cover some of the hospital copays, where if they got cancer or had a heart attack or stroke, they get insurance to cover those items, and the premiums really are very low for that as well. All right. And so if this is not affordable, then this certainly would be the option that I would select. And so do I like supplemental plans? Yes, I do. But are they for everyone? Absolutely not.